Hi, I'm Dr. Jennifer T. Kelly. I'm the CEO here at Michigan Eye Institute. And we just wanted to take a little bit of time today to do an overview on dry eye and allergies. Today I have with me Dr. Brian Mahalak. He is the Director of Referral Services and one of our clinical doctors here at Michigan Eye Institute. And I wanted to start off by just saying, how are things going at the clinic so far?
Yeah, it's going very well. We're having a good day today. We've had some good weather. It's kind of rainy today, but you may notice I'm in my scrubs. I'm excited to be in clinic seeing some patients. I've got my mask, I've got my goggles. Michigan Eye Institute has implemented a coronavirus plan to help protect our patients, our staff, and our doctors. So it's been good to get into clinic and provide some much needed care.
Good. Can you give us a little bit of overview on dry eye and allergies, especially right now with spring coming?
Yeah, absolutely.
We're having a lot of patients that are complaining of red, itchy eyes, and if you can kind of give us a little overview of both the dry eye and allergy.
Yeah, sure. So, dry eye is very, very common. In fact, I would go as far as to say that everybody suffers from dry eye to a certain extent at some point. And we used to think that it was a very simple process where it was just simply the eye becoming dry. But we now know that it's actually more complex than that. It's multifaceted and multifactorial, where there's a number of different elements that go into the ocular surface, the comfort, the vision, and so on and so forth. And so we have to take a multifaceted approach to treating these patients and making sure that we're covering all of the bases. And in addition to that, it's not always just dry eye. A lot of times additional conditions can give you symptoms similar to dry eye and affect your vision, including inflammation on the eyelids, what we call blepharitis, and even allergies, as you mentioned. Allergies can give some blurred vision and some dry eye symptoms, especially this time of year with the weather change. We see a lot of that coming in.
So if patients are having problems, do you suggest that they just kind of go to the store and try out some different products, or is that something that we still recommend patients come in? And what if they don't feel comfortable coming in?
Yeah, that's a good question too. As I said, we used to think that it was a much more simple process, and so simply artificial tears were oftentimes what was recommended. But while artificial tears at your pharmacy or over the counter are still one of the tools that we use, it's really actually one of the minor tools. Now we use a number of different prescription medications to help reduce the inflammation, reduce the redness on the eye, give you long-lasting effect and long-lasting relief from dry eye and related symptoms. And then with allergies, same thing. We have a number of different prescription medications that we can use to really provide relief for our patients. In addition to that, we have some in-office procedures, very simple, very comfortable procedures that we can do for our more advanced cases that can really provide long-lasting relief for our patients in many, many instances. And then the second part of your question of, if a patient at this point doesn't feel quite comfortable coming into office, or maybe they're not able to get into the office, I've been very happy with our program of telemedicine with Michigan Eye Institute. I was on telemedicine earlier this week. We've got a number of doctors that are participating, and it's great to be able to really interact with our patients on a face-to-face level, but from the safety of their own home. We're able to provide excellent care and really help to figure out what sort of issues that they're having and help them in home. And so that's a nice option for them if they're unable to get into the office today.
Perfect. For those of you that haven't seen our past videos on all the protocols and procedures that we put in place to keep you safe, please go back and watch that. We have a ton of different things that we have done, including social distancing, making sure things are wiped down, making sure that all of our staff and doctors have masks, making sure that all of our patients have masks. So hopefully you'll feel safe here. We feel safe bringing patients in. We feel safe bringing our staff in. Thank you, Dr. Mahalak, for that tutorial today on dry eye and allergies. If you have any questions, please reach out to us. As Dr. Mahalak said, we are available by telemedicine. If you have any questions and you're just not comfortable, you can speak to a doctor that way. We're hoping to see everybody soon. Thank you.